Welcome to Module 4.5, where we'll explore grounded theory, a systematic approach to developing theory directly from research data. Unlike approaches that begin with existing theories, grounded theory builds explanations from the ground up. In this module, we'll examine the foundational concepts of grounded theory, explore its various approaches, and outline the process of conducting grounded theory research in healthcare contexts. Grounded theory is a methodological approach focused on generating theory directly from research data rather than testing pre-existing theories. It was developed by sociologists Barney Glaser and Anselm Strauss in the 1960s as they studied dying in hospitals and sought a rigorous method for qualitative analysis. Grounded theory provides a systematic approach to analysis through specific coding procedures and analytical strategies. It follows an inductive process, moving from specific observations to broader theoretical conceptualizations. The approach aims to be explanatory rather than merely descriptive, identifying processes and relationships that explain how people navigate situations. This makes grounded theory particularly valuable for understanding healthcare processes such as decision-making, adaptation to illness, professional socialization, or implementation of new practices. Grounded theory has evolved into several distinct approaches over time. The classic or Glaserian approach emphasizes emergence, theoretical sensitivity, and minimal preconception. The Straussian approach offers more structured analytical procedures and acknowledges the value of existing literature. Constructivist grounded theory, developed by Kathy Sharmas, recognizes that theories are co-constructed by researchers and participants, reflecting multiple realities rather than discovering a single truth. Situational analysis, developed by Adele Clark, expands grounded theory to include analysis of situations, discourses, and non-human elements. Dimensional analysis focuses on identifying dimensions and their properties to understand complex phenomena. Each approach offers different emphases and techniques while maintaining the core commitment to generating theory grounded in empirical data. Conducting grounded theory research involves several key processes. Theoretical sampling directs data collection based on emerging concepts, seeking cases that develop the theory rather than representing a population. Constant comparative analysis involves comparing incidents, concepts, and categories throughout the research process to identify patterns and relationships. Coding typically proceeds through stages. Open coding identifies initial concepts. Axial coding develops relationships between categories, and selective coding integrates around a core category. Memo writing captures analytical insights throughout the process. Documenting theoretical development. Theory development produces a coherent explanation of the studied phenomenon, often represented through diagrams and conceptual models. This rigorous approach generates theories directly relevant to practice, explaining how healthcare processes unfold and identifying leverage points for intervention.